Hi, I'm Professor Dr. Ashish Davalbhakta and we are in Advanced Aesthetics and Aesthetics Medispa in Pune. Today we are going to talk about the myths and misconceptions pertaining to breast implants. There are lots of inquiries that we get, and we know that there are a lot of misconceptions that are asked to us, and I thought that I would do a little YouTube video to educate you on all of these things. One of the commonest misconception is, and that we get asked, is about breastfeeding. And can you breastfeed after you've had a breast implant put in? Now these are silicone implants, and the silicone implants, they are placed either in the subfascial or subglandular plane, which means they go behind the breast and the breast is not interrupted at all. Breast is intact. Or they are placed underneath the chest muscle, which is even further behind the subglandular plane. So the implant doesn't communicate with the breast gland, and hence lactation is not affected at all. So if you have a breast implant and you become pregnant, the breast may grow in size due to the hormonal effect, and you will lactate, and it will not affect the breastfeeding at all. So that's one myth that you can absolutely be reassured with, that doesn't affect, breast augmentation doesn't affect the ability to lactate and breastfeed. Another misconception that we get asked about is, can you exercise? And what would happen if you had breast implants and there are people who are worried that they can't exercise? So let me reassure you, a capsule is formed around the implant by our body, and it secures the implant in a cocoon, and it stays fairly rigidly in its place, and exercise does not affect it. You can go about all your exercises. The only precaution that you have to have is a good sports bra or even a double sports bra, so that the mobility of the implant is controlled or contained, so they don't go up and down. You have to understand that putting in a breast implant of a particular size, let's say 300 or 400 cc implant, is going to make the breast of that volume. So if you had breast of that volume, say a D cup, then the movement or the mobility from any aerobic exercises would be the same, and hence a sports bra would be really helpful. Now coming to weights. Can you do weight training? Now, if you have an implant which is placed in a subfascial plane, which is in front of the chest muscle, then you can exercise fully. You can do all your bench presses, your pectoral exercises without any issue. As I said, only thing is that you need to have a good sports bra to hold the breast implant in place. Now, if you have an implant which is placed underneath the chest muscle, then the pectoral muscles contracts every time you do a bench press or a pectoral exercise where pushing is involved. Anything that involves pushing like this is going to get the pectoral muscles to contract, and that can squeeze the implants a little bit. So in normal exercise, in person who does normal bench presses, again there is no issue. But in professional bodybuilders or in those who are into figure building as a sport, they go very high on the weights of the bench presses, and those movements can constant repeated squeezing and relaxation of the implant can make the implant shell disintegrate or rupture. So they are at a little higher risk of early disintegration of the implant. So they have to be careful, and they should have either alternative exercises or try to put the implants in a subfascial plane. Another myth that is commonly asked is about, can you fly? I mean, if you have breast implants, there used to be some reports that, or rumors that the implants can rupture. Nowadays we use cohesive silicone gel implants, and they are semi-solid, not semi-solid, but kind of a gel where they don't leak or run, and definitely there's no air in them. The fluid implants, saline implants especially, they could enlarge or grow a little bigger if a depressurized situation happens. You mean at a very high altitude, if a depressurization happens, and that is a emergency. So Usually, even at high altitude in aeroplanes, the cabins are fairly pressurized. You don't feel the less pressure and the negative pressure effects. So let me reassure you that absolutely safe in the nice pressurized aeroplane cabin. There is absolutely no risk to the implants, so you should stop worrying that anything would happen to the implants. Another myth is about age, and there are queries about when you can put in an implant and when you can't. Actually, there is no contraindication or restriction on when to put in the implants, but we consider it safe and sensible to put in an implant once the breast tissue has fully grown, which means that the puberty is over and the growth has finished. So we usually avoid putting in implants in anyone who's less than 18 years of age, but there's absolutely no contraindication to putting in an implant at any subsequent age after that. Another and last myth that is commonly asked is about the life of an implant and whether the implants have to be compulsorily changed at a particular after time span. So the companies give a warranty, or they claim that the life of an implant is average between 13 to 15 years. So although they say that, that doesn't necessarily mean that you have to go in and take them out. What we do usually is, if we scan the implants that we normally need to scan, maybe once a year, once in 2 years, and we find that the whole implants, all of them are intact and everything is fine, then you don't need to go and take that implant out. It could be 15 years, it could be 20 years, and I've had some patients come to me after 25 years with the implants. But it's just you have to keep looking at the implants with the scans, and if the shell disintegrates, that will be the time when they should be replaced or changed. But there is no hard and fast necessity that they have to get changed after a particular time span. So I hope that with this we have covered a fair number of the myths that we get asked about breast implants, and hope these answers would enlighten you and reassure you, and you can come and ask in our clinic. Our contact details are there on our website, and we will be very happy to help you. So if you have liked this video, do share it. Thank you very much.